We're focusing on the PD-L1 clone SP263 test using the Ventana platform. This test plays a crucial role in cancer treatment, specifically for guiding immunotherapy decisions in patients with certain types of cancer, such as non-small cell lung cancer. Let's break down what you need to know about this test. Information. Before undergoing the PD-L1 clone SP263 test, there are a few important pieces of information that must be provided. First, the histopathology report of the patient is essential. This report contains detailed information about the tissue sample and any preliminary findings. Next, the site of the biopsy needs to be documented. Knowing where the tissue was taken from can impact test results and interpretations. Finally, a thorough clinical history of the patient, including any relevant symptoms and previous treatments, must be provided to ensure the most accurate testing and interpretation. Specifications of the test. The PD-L1 test, specifically using the clone SP263 antibody, is designed to detect the expression of the PD-L1 protein on the surface of tumor cells. PD-L1, or programmed Death Ligand 1, is a protein that binds to PD-1 receptors on immune cells. This binding interaction can suppress the immune system's ability to attack tumor cells, effectively allowing the cancer to evade immune detection. The SP263 clone is optimized for use with the Ventana platform and provides robust, consistent results that are critical in guiding immunotherapy decisions. Diseases associated. The PD-L1 clone SP263 test is primarily associated with non-small cell lung cancer, NSCLC. However, PD-L1 expression can also be observed in other types of cancers, including melanoma, bladder cancer, and head and neck cancers. Detecting the level of PD-L1 expression helps oncologists determine if a patient is a good candidate for specific immunotherapies, such as Pembrolizumab or Durvalumab, which are designed to block the PD-1/PD-L1 interaction, enhancing the immune system's response against the tumor. Specimen used for the PD-L1 clone SP263 test, a formalin-fixed, paraffin-embedded FFPE tissue specimen is required. This specimen is typically obtained from a biopsy of the tumor tissue. The quality and preparation of the tissue sample are crucial for obtaining accurate results, as the staining intensity and pattern are key to evaluating PD-L1 expression. Components NSCLC test. The components of the PD-L1 clone SP263 test include specific reagents that bind to the PD-L1 protein on the tumor cells, a detection system to visualize the binding, and control slides to ensure the staining process is working correctly. The test also involves automated staining platforms, like Ventana, to standardize the procedure, minimizing human error and providing reproducible results. Report time. After the biopsy specimen is collected and sent to the lab, the PD-L1 clone SP263 test report typically takes about 7 days. This timeline includes the time needed for specimen preparation, staining, analysis, and review by a pathologist. The final report will indicate the level of PD-L1 expression, which is crucial in deciding the patient's eligibility for immunotherapy. Information and CLINICALCIGNIFIKNC. PD-L1 expression on tumor cells is an important biomarker in oncology. By binding to PD-1 on immune cells, PD-L1 can inhibit the immune response, allowing cancer cells to grow unchecked. Blocking this interaction with drugs like Pembrolizumab or Durvalumab can restore the immune system's ability to fight cancer. The PD-L1 clone SP263 test helps to identify patients who are likely to benefit from these immunotherapies, making it a vital tool in personalized cancer treatment.